Hey everyone, this video will speak about appendicitis. What is appendicitis? Appendicitis is the leading cause of emergency abdominal operation. What is meant by appendicitis? Appendicitis is inflammation of the appendix. What is appendix? The appendix is a finger-like pouch attached to the large intestine in the lower right area of the abdomen, that is the area between the chest and hips. The large intestine is part of the body's gastrointestinal tract. The GI tract is a series of hollow organs joined in a long twisting tube from a mouth to the anus. The movement of the muscles in the GI tract along with the release of hormones and enzymes helps digest food. The specific appendix does not appear to have a specific function in the body, and removing it does not seem to affect a person's health. The inside of the appendix is called appendiceal lumen. Normally, mucus created by the appendix travels through the appendiceal lumen and empties into the large intestine. The large intestine absorbs water from stool and changes it from a liquid to a solid form. Now let's see the causes of appendicitis. An obstruction or blockage of the appendiceal lumen causes appendicitis. Mucus backs up in the appendiceal lumen, causing the bacteria that normally live inside the appendix to multiply. As a result, the appendix swells and becomes infected. Here we have the sources of blockage: stool, parasites or growth that clog the appendiceal lumen. Enlarged lymph tissue in the wall of the appendix caused by infection in the GI tract or elsewhere in the body. Sometimes inflammatory bowel disease, which includes Crohn's disease, ulcerative colitis, like long-lasting disorders that also causes irritations and ulcer in the GI tract. Incidence of appendicitis, that is, who gets appendicitis? Anyone can get appendicitis, although it is more common among people 10 to 30 years old. What are all the symptoms of appendicitis? The symptoms of appendicitis are typically easy for a healthcare provider to diagnose it. The most common symptom of appendicitis is abdominal pain. Abdominal pain with appendicitis usually occurs suddenly, often waking a person at night, occurs before other symptoms, begins near the belly button and then moves lower and to the right. Appendicitis is unlike any pain felt before. Gets worse in a matter of hours, gets worse when moving around, taking deep breaths, coughing and sneezing, and other symptoms include loss of appetite. Patient also have an nausea, vomiting, constipation or diarrhea. Sometimes patient has an inability to pass gas, a low-grade fever that allows other symptoms, abdominal swelling, and it is a feeling that passing stool will relieve discomfort. Symptoms can be vary and can mimic the following conditions that cause abdominal pain. Sometimes intestinal obstruction, that is a partial or total blockage in the intestine that prevents the flow of fluids or solid, and inflammatory diseases, pelvic inflammatory disease, that is an infection of the female reproductive organs, abdominal adhesions, band of tissue that form between abdominal tissues and organ. Normally internal tissues and organs have slippery surfaces that let them shift easily as the body moves. Adhesion causes tissues and organs to stick together. Constipation. Constipation is a condition in which a person usually has fewer than 3 bowel movements in a week. The bowel movements may be painful. Diagnosis. How is appendicitis diagnosed? A healthcare provider can diagnose most cases of appendicitis by taking a person's medical history and performing a physical exam. If a person does not have the usual symptom, the healthcare providers may use laboratory and imaging tests to confirm appendicitis. These tests also may help diagnose appendicitis in people who cannot adequately describe the symptoms, like children or people who are mentally impaired. Medical history. That is, the healthcare provider will ask specific questions about symptoms and health history. Answer to these questions will help rule out other conditions. The healthcare provider will want to know when the abdominal pain began, the exact location and severity of the pain, when the other symptoms appeared, other medical conditions, previous illnesses and surgical procedures, whether the person uses medications, alcohol or illegal drugs. Next to medical examination, we have physical examination, that is details about the person's abdominal pain are key to diagnosing appendicitis. The healthcare provider will assess the pain by touching or applying pressure or to specific areas of the abdomen. The responses that may indicate appendicitis include Rosing sign, SOAS sign, appurata sign, Gording. What is Rosing sign? The healthcare provider tests for Rosing sign by applying hand pressure to the lower left side of the abdomen. The pain felt on the lower right side of the abdomen upon the release of the pressure on the left side indicate the presence of Rosing sign. And next is psoas sign. The right psoas muscle runs over the pelvic near the appendix. Flexing this muscle will cause abdominal pain if the appendix is inflamed. The healthcare provider can check for the psoas sign by applying resistance to the right knee as a patient tries to lift the right thigh while lying down. And next is the appurata sign. The right appurata muscle also runs near the appendix. The healthcare provider tests for the appurata sign by asking the patient to lie down with the right leg bent at the knee. Moving the bent knee left and right requires flexing the appurata muscle and will cause abdominal pain if the appendix is inflamed. And next is the Gording. Gording occurs when a person subconsciously tenses the abdominal muscles during an examination. Voluntary Gording occurs the moment the healthcare provider's hand touches the abdomen. Involuntary Gording occurs before the healthcare provider actually makes contact and is a sign the appendix is inflamed. Appendicitis patient also has rebound tenderness. The healthcare provider tests for rebound tenderness by applying hand pressure to a person's lower right abdomen and then letting go. Pain felt upon the release of pressure indicates rebound tenderness and it is a sign the appendix is inflamed. A person may also experience rebound tenderness as pain when the abdomen is jarred. For example, when a person bumps into something or goes over a bumps in a car. Women of childbearing age may be asked to undergo a pelvic exam to rule out gynecological conditions which sometimes cause abdominal pain similar to appendicitis. The healthcare provider may also examine the rectum which can be tender from appendicitis. Laboratory testers. Laboratory testers can help to confirm the diagnosis of appendicitis or to find other causes of abdominal pain. First, we have blood test. A blood test involves drawing a person's blood at a healthcare provider's office or a commercial facility and sending the sample to a laboratory for analysis. Blood tests can show the sign of infection such as high white blood cell count. Blood tests also may show dehydration or fluid and electrolyte imbalances. Electrolytes are chemicals in the body fluids including sodium, potassium, magnesium and chloride. And next we have urine analysis. Urine analysis is the testing of urine sample. The urine sample is collected in a special container in a healthcare provider office. and a commercial facility or a hospital, or it can be tested in the same location assigned to the laboratory for analysis. It is usually used to rule out a urinary tract infection or a kidney stone. And next we have pregnancy testers. Healthcare provider also may order a pregnancy test for women, which can be done through a blood or urine test. Imaging testers. First we have abdominal ultrasound. Abdominal ultrasound creates images of the appendix that can show signs of inflammation, a burst appendix, a blockage in the appendix lumen, and other sources of abdominal pain. Ultrasound is the first imaging test performed for suspected appendicitis in infants, children, young adults, and also for pregnant women. MRI testing, that is magnetic resonance imaging. An MRI can show a signs of inflammation, a burst in the abdomen and blockage in the appendix lumen. It is also used to diagnose appendicitis and other sources of abdominal pain. Next is the CT scan. CT scan uses a combination of X-rays and computer technology to create 3D images. A CT scan of the abdomen can show signs of inflammation such as enlarged appendix or an abscess, a first-filled mass that results from the body's attempt to keep an infection from spreading, and other sources of abdominal pain, a burst appendix and blockage of lumen. Women of childbearing age should have a pregnancy test before undergoing a CT scan. The radiation used in CT scans can be harmful to a developing fetus. How is appendicitis treated? Appendicitis is treated with surgery to remove the appendix. The surgery is performed in a hospital. General anesthesia is needed. If appendicitis is suspected, especially in patients who have persistent abdominal pain and fever or a sign of burst appendix and infection, a healthcare provider will often suggest surgery without conducting diagnostic testing. Prompt surgery decreases the chance that the appendix will burst. Surgery to remove the appendix is called an appendectomy. A surgeon performs a surgery using one of the following methods: laparotomy and laparoscopic surgery. What is laparotomy? Laparotomy removes the appendix through a single incision in the lower right area of the abdomen. What is laparoscopic surgery? A laparoscopic surgery uses several smaller incisions and special surgical tools fed through the incision to remove the appendix. Laparoscopic surgery leads to a fewer complications such as hospital-related infection and has a shorter recovery time. With adequate care, most people recover from appendicitis and they do not need to make changes to diet, exercise or lifestyle. Surgeons usually recommend limiting the physical activity for the first 10 to 14 days after a laparotomy and for the first 3 to 5 days after laparoscopic surgery. What are all the complications and treatment of a burst appendix? A burst appendix spreads infection throughout the abdomen, potentially dangerous condition called peritonitis. A person with peritonitis may be extremely ill and have nausea, vomiting, fever and abdominal tenderness. This condition requires an immediate surgery through laparotomy to clean the abdominal cavity and to remove the appendix. Without prompt treatment, peritonitis can even cause death. Sometimes an abscess forms around the burst appendix called an appendiceal abscess. A surgeon may drain the pus from the abscess during the surgery or more commonly before surgery. To drain an abscess, a tube is placed in the abscess through the abdominal wall. The drainage tube is left in place for about 2 weeks while antibiotics are given to treat infection. 6 to 8 weeks later, when infections and inflammations are under control, surgeon operates to remove what remains of the burst appendix? What if the surgeon finds a normal appendix? Occasionally, a surgeon finds a normal appendix. In this case, many surgeons will remove it to eliminate the future possibility of appendicitis. Occasionally, surgeons find a different problem which may also be corrected during surgery. Can appendicitis be treated without surgery? Non-surgical treatment may be used if surgery is not available, a person is not well enough to undergo a surgery, or the diagnosis is unclear. Non-surgical treatment includes antibiotic to treat the infection. What should people do if they think they have appendicitis? Appendicitis is a medical emergency that requires immediate care. People who think they have appendicitis should see a healthcare provider or go to the emergency room right away. Swift diagnosis and treatment can reduce the chances the appendix will burst and improve recovery time. Eating diet and nutrition. Researchers have not found that eating diet and nutrition play a role in causing or preventing appendicitis. If a healthcare provider prescribes non-surgical treatment for a person with appendicitis, the person will be asked to follow a liquid or soft diet until the infection subsides. A soft diet is low in fiber and is easily digested in the GI tract. A soft diet includes milk, fruit juices, eggs, puddings, strained soups, rice, fish, mashed or boiled potatoes. People can even talk with the healthcare provider to discuss for any dietary changes. Thank you.